Now, the Purple for Premature Summit is the first multi-sectorial forum by the AFPNC designed to include parents, patients, representatives, as well as key stakeholders in providing quality healthcare for babies born too soon, sick or small here in Ghana.
I think it's a very important call. So I hope it's going to be well attended and that whatever is discussed today will contribute to advance in any interventions that are needed to reduce newborn mortality.
It's a good event for us to discuss policies, what is required in that space, and what can be done better within the healthcare system. So kudos to the team for organizing this. At the same time, as I represent our nurses and midwives, I know our pediatric nurses are doing their best, but there are a lot of challenges within the space in terms of caring for premature babies.
I shall say the mom from easy. Before me go question you cry, the mom. It's me Gina entrance now, it's me swan. You want me to me remumpo.
My first day, I'm running for me home baby, Miss Shumye. Say, as a real fufuru be a woolroom for a wound name the air course. Then so true Nico nurses and almost say you can say, and ya dear, a dear you who be a bit to my ye.
Premature me man funny easy. Almost an air dim pa. Say, who near Butra, Untimation Colano. Heading.
Very unfortunate, me wo me bano. 3 days time and sana minya access. Akwa huno. Me wo no na my emre. My week I can't move. So I was on bed for 3 days before seeing my baby. But the American said me wo me bano 28 weeks. That was 1.65. That was my first time. And apart from na minim crazy will be a friend of premature and preterm. But 3 days time, my husband be saw me inside me call Nico na me go hu akra no. To be honest, na me intimi enso akra ni mu. Me when say I say no, it's so tiny, and I was afraid.
I'm very, very, very happy to be here because the African Foundation for Premature Babies and Neonatal Care, it's a leading group in advocacy and creating awareness of prematurity. And as we know, the month of November is a month dedicated for the preterm. Today, the activity, I'm so impressed that when I came, I've seen so many partners involved. All these are good stakeholders who can help in bringing and advocating for the preterm.
I think this is a brilliant initiative. It's important that spaces like this should have their own voice, and it's important that we have people like Selena and yourself and the organization pushing this. So this is fantastic.
So please, what's your expectation for the summit this afternoon?
Okay. So I think this is a very good initiative. This is a program that will initiate a set of discussions that would push the agenda for preterm babies. So it's usually one conversation and another and another and another. And I think this is the beginning of it. And it's very important, especially for people who are affected by issues like this.
I'm happy to be here, and working with preterms is exciting and it's a great experience. Having this summit is a good cause anyway, but for me, I think more awareness needs to go out.
In fact, it's a very good event that you've put together. The reason why I'm saying this is, as a midwife, I know what mothers go through, especially mothers who go through pregnancy and on the way have to just bring the baby out because of so many issues. So it is very good. Society have so many ideas about preterm babies. Their care is very, very difficult. We don't usually talk about it. And as a midwife, if it happens that way, it becomes very difficult for nurses, midwives, and doctors to care for such babies. We don't want to lose these babies. So I'm sure this summit is going to talk about coming together to take care of them. The society the family, the healthcare workers, the church, all stakeholders coming together can just help take care of these babies. And then we have a very good family, good people to take care of the country. Thank you very much.
Thank you, Mommy, for your time. We appreciate.
Preterms are special in that although they are born too soon and too small, they brave the odds to survive. And more I keep coming across very important people in society, and they whisper, I was a preemie, you know, which shows that more and more these very vulnerable little ones are surviving.
This moment is what we've been looking for because it is time. It is time not to leave the conversation on prematurity to only healthcare professionals, because they love their work, they love what they do, but they are limited in their state of advocacy. In fact, they cannot fight the government who pays them. And so there's supposed to be a multi-sectoral approach on prematurity. The parents are equal partners like healthcare professionals, government, and the community. And so today, we have all gathered here as voices for babies born too soon in the NICUs right now. Our decisions, our discussions are going to influence them. And for those that might be born, our decisions here and what we will do after will determine whether they make it alive or not. So our purpose here today is to speak up, take action, and make it quick action so that babies born too soon here in Ghana can have the best possible start in healthcare. Thank you.
For premature babies, every moment is delicate and every decision impacts survival. Yet, across many healthcare facilities, a silent but profound crisis persists. Insufficient water, sanitation and hygiene services. This deficit undermines infection prevention and control measures, jeopardizing the safety of babies, mothers, and healthcare providers alike.
The recent 2022 World Health Organization recommendations for care for premature babies recommend that mothers and babies should be kept together as much as possible to really allow the full implementation of many interventions which imply both mothers and babies. A fully integrated mother and baby model of care requires a lot of changes. It requires a lot of cultural changes, organizational changes, architectural changes, funding changes. So far, only few countries like Sweden and Finland have implemented fully integrated maternal and newborn care units with promising results. In Ghana, there is some initiatives to allow mothers to stay closer to the babies, either in a unit that's not too far or even in the same unit, but in another part of the unit. This is encouraging, but it's not sufficient. A fully integrated model of care will probably provide much important and sustainable gains.
Sometimes our mothers also get confused and overwhelmed, and they just don't know what to do. Motherhood is torture. They say the joys of motherhood, well, you make it a joy because you decide to, because it is tough. Having preterm or a special child, a child with disability or special needs, takes a lot of sacrifice, a lot of sleepless nights, a lot of mental fortitude. And they deserve all the support, all the care, all the love. But unfortunately, sometimes, not the men in this room, Men run away and leave them. Families abandon them. Then all sort of conditions set in, and they are totally lost. And then through that, they lose their babies.
So every year, we will be honoring an individual who has distinguished herself or himself and made a significant contribution towards maternal and newborn care. This person isn't just someone who is just a healthcare professional, but she has a heart for people in a special way.
She has indeed contributed significantly and immensely to the health of children in Ghana and in West Africa.
I have an NGO called Hope for Little Lives. We do free surgeries for children in deprived communities. I thought it wise to let her know because she's a pioneer in the field. And she really welcomed the idea. She encouraged me. She supported me. We've been in existence since October 2021. And for our first outreach, this 60-plus old woman went with us all the way to the Upper West region of Ghana, Wa to be precise. And this gave us so much credibility that to have the first female pediatric surgeon, Prof. Hesse, with you, it meant that you were doing the right thing. Prof, you don't know how much that means to me.
She is a real trailblazer, having rendered outreaches to various parts of Ghana, including Tetekwashi Memorial Hospital, Whole Teaching Hospital, when it was Whole Regional Hospital. She used to go there to offer regular surgical services for children who couldn't come to Accra to obtain such care.
If one day we are to bring together all the children that Prof has helped in one way or the other, and the mothers, I tell you, we will fill the stadium and over. And she does it without, she does it because she loves to do it. And she never gives up. I look up to her, and I hope the student here will look up to her. Look at how she's looking. Still beautiful, still healthy, still amazing, still full of smiles. All because she's a woman filled with love and sacrifice. And when the Bible says that when we give, we receive, this is a clear example. And he or she who gives is really the richest amongst us. Prof, we salute you. Now let me read the citation in honor of Prof. It says, "You have nurtured dreams of many in healthcare and demonstrated exceptional leadership and commitment throughout your career. As a pioneer in the medical field, you have set standards of excellence in healthcare, education, and service. Your hard work, integrity, and ability to overcome challenges have made you a source of inspiration to many. Through your mentorship and groundbreaking contributions to pediatrics, surgery, and maternal health, you have touched countless lives and shaped the future of healthcare. Your legacy continues to inspire the future generation of healthcare professionals and leaders. Thank you for giving parents and patients a voice through your selfless support for the African Foundation for Premature Babies and Neonatal Care. Congratulations on your remarkable achievements so far, and we urge you to continue to fight on. You are officially a champion. Can we all be upstanding? Hip, 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 hip!
First of all, I want to say thank you to the foundation, because what they did was a bit surprise to me. And I was sitting here shaking the whole time. But thank you so much for that honor. I give a talk on the difference between public and private sector in terms of healthcare, because I've had the privilege of working in both. And one of the things I talk about, wash. When I go to an institution, I can tell the culture of that institution by asking to go to a washroom. Sometimes you see people looking at each other and looking at which one, they'll say, oh, we'll go and open it and clean it before you come. But if each and every one paid attention to that, there will be something that your patients can be proud of. At least clean, at least toilet roll. Even sometimes for the staff, there's no toilet roll, but nobody seems to be bothered, or no one wants to be responsible. So it's something that we all should take on board. When our patients come with diseases, if we are not careful and we don't wash our hands, we will be taking it home to our own family.
We need to come together and form a formidable force or voice to champion the cause.
So when you look at the Sustainable Development Goal 3, there is something about reducing deaths of premature babies or neonates in general. And it's important that we look at it and address the issues as stakeholders.
When it comes to quality of care and even for reduction in neonatal mortalities, it is everybody's business. However, when it comes to policy formulation and development, there should be a lead. And in Ghana and even in some other jurisdictions, the ministry takes that leadership role.
We have different levels of prematurity, depending on either the gestational age or the weight. So below 28 weeks is severe prematurity. So usually the weight tends to be less than 1 kilo. And we have those who are between 1 kilogram and 1.499 kilos. So that is not so preterm again. And then we have those between 1.5 and 2 kilos. And also we have those between 30 to 33 weeks, 33 to 36 weeks. So all those things are taken into consideration on the level of prematurity. But less than 28 weeks is severely premature, and in some circles is considered as actually pre-viable. It's not a viable baby.
Preterm delivery cannot completely be prevented. As the obstetrician is here, she'll be the best person to let you know that. But we have conditions that if you take time and you follow very well, you could either push the preterm to near term, or you could prepare the lungs of the baby, the brain of the baby, and deliver. Some of those conditions, we can talk about something like preeclampsia, or it means the mother develops BP. The obstetrician would have to control the BP and try to push the baby. But it gets to a point that nothing can be done. You either take the baby out or you lose the baby and the mother. And then a baby comes out as a preterm.
I wish that once we knew we were going to be parents, there was a conversation about this could happen. So prepare yourselves for that event if it does happen. We're not saying that we want it to happen, but just prepare yourselves, for it. As the father, kind of make sure that wifey is doing A, B, C, D. Support her in that area.
Society should be made to understand that it's not a taboo to give birth to a preterm baby, be it a boy or a girl. My candid advice is that preterm borns are susceptible to infection. So it's very, very important that you maintain a very, very clean environment. Then also be mindful of the people who come around the baby. I would advise that you limit the visitors to at least 2 or 3. That's you, the mother, and the father. Accept that the baby has been born preterm and there's nothing you can do about it. All that you have to do is to care for the baby. We are in this together. We can do it. Thank you.
It's been very great today. We've had a very great experiences and we've learned a lot. We're privileged to meet a lot of doctors, professors to share their ideas on prematurity. And it has been very, very great. We learned a lot and we're also privileged to meet honorable people like Gifty Auntie, Professor Hesse and the rest. Thank you very much.
Yeah, I think my experience has been overwhelming. I think that this particular initiative is a very good one, and kudos to AFPNC. I think that we should look at ways to engage other sector players. Newborn care is beyond the healthcare facility, is beyond the healthcare system. We need to embrace other collaborators. We need to look at the water, sanitation and hygiene. We need to look at stakeholders from the community with voices, amplify their voices. And I think that I saw that really here. And I'm so proud of what AFPNC has done and looking forward to a much more impactful initiative in the coming years.